This is Bradley Chiropractic Nutrition Center podcast number 1 with Dr. Brendon Bradley. Today we want to talk about health and how we can attain a higher state of health through nutrition. I've been in practice for 20 years and have treated a variety of different patients. When I first started, I really started off as a traditional chiropractor dealing with basic musculoskeletal problems, aches and pains, low back pain, headaches, things of that nature. And as I have moved forward in my practice and really had a desire to help people at a deeper level, I really moved towards incorporating nutrition into our practice. The bottom line is drugs have serious side effects. Most prescription drugs have side effects no matter how you look at it, and some of them are serious. Use Vioxx as an example. Vioxx was on the market in the mid-late 90s. It was an arthritic drug, got approved to market pretty quickly, and wound up causing a lot of damage, a lot of harm to people. The stats that I have on that were there was 139,000 people who had heart attacks as a direct result of Vioxx. And FDA finally pulled it off the market. That's just an example. There are many drugs who make it to market that should have never been there. And even if they aren't drugs that had issues like that, prescription drugs are really just kind of setting you up for failure. Once you get started on one, often the side effects create the need for another drug, and you begin this vicious cycle. So I like to intervene and try and, either prevent somebody from ever having to get to that point, or if they are on a lot of prescription drugs and they want to try and improve their health, I like to work with them and see if we can improve their health, get them healthy enough so that they can begin to work with their medical doctors and decrease their need or get off prescription drugs if possible. So one of the things I want to talk about is we're really a conditioned society. We are very conditioned by pharmaceutical companies. We think it's normal to be on prescription drugs, especially once you reach a certain age. I hear people tell me all kinds of things that really astonish me. So when I see a new patient, one of the things that I go through is, obviously we start with the reason they're there. Whether it be headaches, neck pain, low back pain, maybe they got in an accident. Most of the time people don't come directly in with complaints of digestive issues or diabetes or high blood pressure. Those are not usually why people originally make it to my office. So I'm going to talk about the average patient, and this is kind of sets the stage for really what we've accepted as normal, what society views as normal. So a patient will come in, let's just say they have low back pain, and I go through the process of consulting them, talking about their pain, how long they've had it, what they've taken, and what they've done. And once we get done with that chief complaint and the reason we're there, then I move into the rest of my consult. And one of the questions I ask a patient is, I know you're here for your low back pain, but do you have any other problems with your health? And 9 times out of 10, they will say no. And I go, okay, and we move on. And I ask a few more questions. And one of the last questions I ask a patient is, okay, are you taking any prescription medications? And they say, yes. And I pause for a second and I ask them what they're taking. And they'll tell me, well, I'm taking a blood pressure medication, a cholesterol lowering medication, and an antacid. And I'll say, well, that's interesting. I just asked you a few questions back whether or not you had any complete, health complications or problems with your health. And you said no. And they say to me, well, I don't, because I'm taking those prescription drugs. And that just baffles me, to be honest with you. But it really, really proves the point. That's how we think. We are such a medicated society that becomes normal to people. They really think that, well, if you have a disease or you have a condition and it's controlled through a prescription drug, that you don't have the problem anymore. You still have the problem. And really, you can't get off that prescription medication. It's going to come right back unless you take steps to go a natural route. You really take charge of your health. And that's really what I want to talk about today and stress to you. So I want to talk about 6 things that almost every patient who has symptoms and is on prescription medications, these are the 6 top things that I see. These are the 6 top things that I'm told by patients. High blood pressure, high cholesterol, acid reflux or GERD, diabetes, difficulties with sleep, and then analgesics or pain relievers. The thing I want to stress about all of these conditions is these are almost completely preventable. They're all chronic degenerative diseases that really came about due to poor choices, poor dietary choices, poor lifestyle choices, not exercising enough. They really came on because somebody wasn't taking care of themselves, to be quite honest with you, which means these are conditions that we can avoid, or if we already have them and our health has gotten to a point where we have these problems, most of the time, not always, but most of the time, they're reversible. Okay? And they're reversible through lifestyle changes, good nutrition, good dietary habits, exercise regularly. These types of things can reverse or prevent these conditions. And these are the things that I see all the time. And this is most of society, really. So here's the question. If you knew there was a way to take control of your health, and you could do it naturally, and you had a set plan, and you had a way to measure where you are now and where you could be in maybe 3 to 6 months, and I could show you that you could take control of your health no matter what the condition may be, would you do it? Would you be interested? I know a lot of you would say, well, yeah, of course. But there are some that would say no, and that is really, really shocking to me. Some people would really rather just do what they want to do, eat what they want to eat, live the lifestyle they're living, and not make any changes because they don't want to put the work in, and they'd rather just take the medication and keep doing what they're doing. And I get people like that, and I can't help them, to be quite honest with you. And it's a sad thing, but it does prove that there is a mindset in our society that some people do think that way. But I don't want to dwell on that. I really want to talk about people who are wanting to take control of their health. It is our responsibility. Our health is our responsibility and nobody else's. It's not a doctor's responsibility. It's not your spouse's. It's not your family's. It's yours. So first and foremost, you have to decide it's something you want to do, and then you have to have a plan. You have to have somebody or a way to give you some guidelines, give you a course to follow. And then really what we do here is give people a means and a way and a plan to turn their health around. So let's define health. Is health just the absence of disease? Or is it something different? And I like to use the World Health Organization definition. Basically, it says, I'm going to paraphrase, it says health is I'm going to find it for you because I can't paraphrase it. All right, where do I have that? World Health Organization, which is called the WHO. Definition of health: a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So that's the definition of health that I like to use. And we want to try and get people to that. So what is our approach? What we use is a system. We use blood analysis. We're affiliated with a company called Science-Based Nutrition. And we use a blood test that does over 50 different traditional analysis on the blood. And we take that information and we look at the numbers, and we can basically show people whether they are just starting to have warning signs, whether they're out of range clinically, or whether they're really having a problem. And the way we do that is we use 3 different colors on our lab tests, on the results when we get them back. So we use yellow, red, and blue. Okay. I'm going to give you an example of a yellow. Let's say that somebody, one of the tests we run is called a BUN, which is a blood urea nitrogen. It's a kidney function test. The clinical ranges for that test, which is a average that is developed by laboratories across the country, the average, clinical averages for that are 6 to 24. Okay? So what we do is we take that range and we create a range that we call a healthy range. We basically tighten the range a little bit. We decrease those numbers. And the reason for that is, so if the normal range is 6 to 24 and you're at 24, are you healthy? Well, you might be clinically normal, but it's indicating that your kidneys are starting to have a load on them. They're starting to have difficulty functioning the way they should function. They're not functioning optimally. So we take that range and we tighten it up a little bit. The healthy range that we use is 8 to 18 instead of 6 to 24. So, for example, I'm looking at a test that was done on a patient and their BUN was 20. So it shows up as yellow on our results. Okay? That means that it's a warning. It's clinically normal, but it's starting to get high enough that can we do something to bring that down? Can we do something to help those kidneys improve better? Okay, so that's yellow. Then we have red, and red is now, if you're using the clinical range, red is something that's outside of the clinical range, okay, but maybe just barely. So maybe it's 25, 26. And then if something gets really high and it really becomes problematic, it's blue. It's what we call high risk or critical. So we use these numbers to evaluate somebody's health and see where they're out of range, see where there's weaknesses, see where we can help their body get stronger, improve. All right. I'm going to give you some examples of some case studies with this approach. When we get these results, the way we treat these people is completely a natural approach, all through high-end nutrition, top quality nutritional products, and dietary recommendations and lifestyle modifications. So I'm going to give you an example of a patient. It's a 59-year-old female. She complained of extreme fatigue. She had recent loss of vision. She had digestive problems and recurrent sinus infections. Okay, I'm going to just focus on her glucose levels and her triglyceride levels because these were the problems. Her first test, her glucose was 353 and her triglycerides were 633. So normal glucose levels should be 65 to 99. Okay, our healthy range, we'd want somebody to be between 80 and 95. So it goes without saying 353 is really, really high. This is somebody who has severe diabetes and they have an issue, which is why they had the loss of vision. We put them on a complete natural, no drugs were used, complete natural protocol. And 2 months later, we did 3 tests in total, but 2 months later, we retested this person and their glucose had come down to 232. Triglycerides had come down to 250. A year later, she stuck to the program, did what she was supposed to do. Her glucose a year later was 99 and her triglycerides were 207. Okay, pretty dramatic. Okay, that's a big change in somebody's health, and they did it without drugs. Okay, I'll give you another example. 54-year-old male. He was a type 2 diabetic. He had been on glucophage for a year. First test, glucose was 322. His HA1C, which is another test used to measure diabetes, was 13.8. Same thing, natural protocol of specific nutrition, and dietary changes. Went from 322 down to 86 3 months later, and his HA1C went from 13.8 down to 8.30. Okay, pretty dramatic, right? The last example I have, and then we'll talk about some other things, but these are just so exciting. I wanted to share them with you. This is a patient who had a glucose of 178. 2.5 months later, they were down to 93. Their HA1C went from 8.7 down to 6.7. All right, so the beauty of this is we are able to objectively decide and choose what somebody should be taking nutritionally. And this is what I love about this approach. Even if you're open to nutritional supplements and you think, yeah, they're healthy for me, I need to be on them. If you go to a health food store and you want to get on some nutritional supplements, you just kind of buy what you've been told is good for you. So you might say, okay, well, I know I should be taking fish oil. They say that's good for cardiovascular health. I know that they say B12 helps give energy. Ginkgo biloba is good for my brain. I should be on a multivitamin. I've also heard that probiotics are good and enzymes, and maybe valerian root's going to help me sleep, and you just go on down the line, and you buy all these things with good intention. You got a bag full of stuff. You've spent a couple $100, but you really don't know if it's going to help you because there's no way for you to objectively measure whether it's changing your biochemistry. And sadly, most people, they won't really stick to it. They won't finish them all. You can go in a lot of people's, medicine cabinets, and a year later, those nutritional supplements are still sitting there. So this approach allows us to objectively see where your body's out of balance, biochemically out of balance, put you on nutrition that's specific to your needs, high-end nutrition that's doctor-guided, and then we use these blood tests to make sure that what we've put you on is going to change your biochemistry by retesting. That's the beauty of this. So I just wanted to share that with you guys. I'm excited that we can offer it, and we can really help people take their health to another level. So the goal is to be healthy and drug-free through healthy diet and lifestyle habits. We truly are what we eat. Okay. It's, when you talk about health, it's what and how you eat. It's how you move, which comes down to exercise. And it's what and how you think. These things are all important. And if we do all these things properly, we can take control of our health and get to a healthier state. There's really two different types of patients that we see and that we treat. Some people do have problems, they have symptoms, they have issues, and maybe it's a patient who has gone to medical doctors and really has not been given any answers. And we see this because of what I described earlier with the clinical normal ranges. You can be clinically normal and still have problems. Your body can start breaking down but be clinically normal on a blood test. So we can often give that type of patient some hope and some answers and some guidance by, getting that range a little tighter and getting them on proper nutrition, and their symptoms are going to go away. The other kind of people that we can treat or see are people who they're already healthy, they're proactive about their health, they are exercising, they're eating right, and they just want to come in and take it to a higher level and find out if what they're doing is working. And no matter which type of patient, we can use these tests and use our systems to help either one of them. So we're excited about what we do here. And really, like I said in the beginning, it's all about choices. You have to choose to take control of your health. So with everything I've said today, my hope for you and anyone who's listening to this is that you choose health. I want to thank you for listening to this podcast, and stay tuned. We'll talk to you again soon. Thanks.